Today. I am so excited to introduce Kathy Bochnowski. She is a physical therapist and board certified as an orthopedic clinical specialist. In order to provide physical therapy for a patient population often overlooked, Kathy founded the Women's Health and Pelvic Floor Dysfunction program at MountainTop Physical Therapy in 2005. With a knowledgeable and compassionate approach, she educates and assists these patients with diagnoses including incontinence, post-natal problems, prolapse, constipation, diastasis, and pelvic pain conditions. So without further ado, I'd love to pass it over to Kathy. And again, don't forget to put your questions into the comment. At the end, we'll leave time for us to do a little Q&A. Thanks so much, Kathy.
Thank you. Thank you so much to the Hive Family Collective. I think what the three of you women are doing to pull this together and have these resources all in one place for new parents and even parents of older kids. I just think it's amazing, and Park City has needed this for a while, and I'm so grateful to be here and be a part of it. So thank you, and thank you to everybody who's here today listening. So as Perry said, my name is Kathy Bochnowski, and I'm a physical therapist. I work at MountainTop Physical Therapy, and I have that background in orthopedics, but as of 2005, I really felt compelled to treat this population of pregnancy and postpartum, but the whole span of womanhood, really, and all the changes that our bodies go through. And so the inspiration for transitioning to provide that type of care is really right here. My family, especially the two kids. And no, it's just, I like to get personal when I present. I want people to know who I am. And so maybe it helps the people that are listening feel a little more comfortable too, sharing their stories with me. And so no coincidence that my son in these photos just turned 16, and 15 years ago, I started treating pelvic and abdominal health. And the coincidence is that I had a traumatic birth, and it was so hard. And we didn't have any resources here in Park City, nothing on the Wasatch Back. And so I had to find them, and they were on the Wasatch Front at the time. I had a great pelvic floor therapist who helped me and then inspired me to start providing these services to everybody back here. And it was a little bit of an island at the time, and now we've grown, and the field of pelvic and abdominal health it has just spread like wildfire throughout the country. There's so many great resources, and I think young moms are now even really proactive in knowing, like, hey, I'm going to advocate for myself. I don't feel great. Who can I go to? And so there's networks all around the country now, which is really awesome. But these are my little inspirations here. So, let's move forward. So here's the purpose. I have a lot of things I want to cover. We treat so much. From teenage years, even there's specialists who really help children who have problems with constipation or bedwetting and such, all the way through end of life. I've helped many women in their 80s. So it's a very broad scope, and I'm trying to narrow it down a little bit, but I'd like to let you know some of the topics that I want to hit upon. What it means to specialize as a therapist, the impacts of pregnancy on your body, how as a physical therapist, I can help to even maybe prepare you for a better delivery, smoother delivery, which then also helps set you up for recovery. Recovery, via vaginal delivery or C-section, they both come with their own challenges. And so we'll talk about that. My number one exercise, because people will always come in and say, what do I do? What's the one thing? I have no time. We're going to talk about what that exercise is. Very common diagnoses and complaints that I hear about during pregnancy, but also postpartum. And this one, the muscle incoordination. I want to make sure everybody today understands what I mean by incoordination and how that is even almost more important than just being weak. Of course, indicators that you should see a pelvic health PT. How do you know when enough is enough and it's time to get that extra help? And then I definitely would like to save some time for Q&A and answer any specific questions that you guys have, because I know I have to kind of run through these topics quickly. So to hit on that, what does it mean to specialize as a pelvic health therapist? So in addition to the regular education that we receive, it's just lots of continuing education. These consist usually of 2 to 4 day courses, lab work. Our lab work gets up close and personal. You know, when you go to this course, you are the clinician, you are the patient. And so you're really getting your hands on one another in a really intimate way, but that's the way that you learn the art of being a pelvic floor therapist, and then also learning the skills and the knowledge and stuff behind it. So it is a never-ending path of education. I every year take at least a couple of courses so that I can keep getting better at what I do, refining it. So it takes a lot of extra work, but that's how you stay up and current to really give the best care possible. Okay, let's move on. Right in there, look at that, right? So effects of pregnancy on your body. This is just one of my favorite pictures, this diagram. So this is looking at a woman's body cut right down the middle. The image on the left is a non-pregnant body, and the image on the right is clearly a pregnant body. And some of the things that we kind of just take for granted that this happens, and it's meant to happen, and maybe we think it should be easy. Many of us have found it's not. But look at the changes on that body. So, I mean, the breast size increases, the lungs expand, the expansion of the lungs goes upward. You can see on that image where the baby grows and grows and grows upward, and it compresses the diaphragm upward and therefore limits your lung expansion. This is why sometimes in pregnancy, as you might just walk up a flight of stairs and it feels as though you have run a quarter mile. You know, it is exhausting, and it's because your lung capacity can't, it just isn't there. It's blocked a lot of the time. And we all have different body configurations. Some of us have broader ribs and longer torsos, or more space for that baby. Others have really short torsos and longer legs. And so that baby really takes up a lot of the space. And that can impact why some of us feel some ways and others don't. It doesn't impact as much. Then take a look at those intestines. That's kind of the little blobs, somewhat circular, semicircular, easier to see on the left image, harder to see on the right because they do get squished, making you more susceptible to digestive problems, especially constipation and hemorrhoids forming. Speaking of getting squished, where's the bladder? You know, it's that little yellow slice on the pregnancy spot. And so when you are pregnant, it is normal. That is one of the times it is very normal to have to use the bathroom more frequently, and even to have to use the bathroom at night. Postpartum, different story. We don't want you to have to be racing and running to the bathroom all the time. That should start to come back to normal. Lumbar sway back, or lordosis. This picture really doesn't even do justice to how much of a curve people can get in their back. I mean, the lumbar spine, sometimes I've seen, is just so radically curved because it has to counterbalance all the weight that's growing on the front of you, your abdomen. And so that can result in a lot of discomfort in your low back. Then just moving down, the abdomen. It's a hot topic, right? Diastasis, rectus, abdominus, or the DRA. Well, it's a big reason why, and you can look at that image. Somehow, very quickly, usually from the time you're about 4 months, you're really starting to show to that 9-month period, boy, things start to expand, and what that does to all those tissues around there. So your abdominal wall stretches and all those muscles too, and that can lead to the separation of those muscles, which is what we call the diastasis rectus. And then even moving farther down, those pelvic bones, they start to spread. This is all good stuff, right? Because we need to make space for the baby. We need our pelvises to loosen and expand to make way for this baby to come out. But these are all really huge changes, and they can have a lot of impacts on our bodies. And then also think about at the very bottom of the picture now, your pelvic floor muscles. The weight of the baby growing with time really starts to take up so much space and put pressure down. And I love using this analogy of a trampoline in a Park City winter. So I don't know who has a trampoline out there. If you've ever, we've all seen them in the neighborhood. Most of us in the fall know you have to take down the spring part of that trampoline before the snow starts to fall. Because if you don't, what happens over time is it just keeps snowing and snowing. We hope, right? In Park City, we want that snow. But the weight of that snow gets bigger and bigger, much like a growing baby with time. And our pelvic floor represents that trampoline springy part. So by the time spring hits and the snow melts, if you didn't take off that trampoline, your kids will go out on it and they go to jump and they're like, there's no spring anymore. I can't get as high, when I'm jumping. And that's just, it's the principles of a low load, but over a long period of time, and how that can stretch and weaken structures, much like what happens to our pelvic floor with time. So it's a normal occurrence, but we definitely want to work on getting that strength back, getting that tone back into the pelvic floor. And then the final thing, effects of pregnancy, there's no way around it. You're going to gain weight. Your blood volume is increasing, baby, mammary glands, all these different things. And so we know that that's going to be another huge impact on all your joints, even down to your feet. So lots of changes. But again, these are all really good things. They're natural things, but they don't always feel great. In fact, sometimes you can feel like this when you're pregnant. I'm sorry, I know it's all kind of fuzzy and hard to read, but basically pregnancy, yes, it's beautiful and we want to embrace it, but let's get real too. It's hard. It can be very hard on a lot of us at different times too. So I like to throw in these little humorous slides. She's tired. I think she's got some bags under her eyes. Pregnancy is not always easy, but there is a way to get back your strength. Okay. Let's talk about pregnancy and let's talk about some strategies. Like if you were to see a pelvic health therapist, there are some things that we can do that can help to ease your pregnancy, but also help you for a smoother delivery possibly. So, we do our basic things, pain management. So let's say you're having neck pain, back pain, pubic symphysis pain, which is right in the front area by your pubic bone, even leg cramps, headaches. Physical therapy can help with all of these things. We like to do a lot of manual therapy for our treatments, so hands-on activities. When I see somebody who's pregnant, very rarely will I do internal examination work unless I get clearance from their doctor or nurse practitioner or midwife that we're cleared to do that. So our manual therapy during pregnancy is really staying on the outside of your body, trying to realign things, ease tension, etc. Exercise, there's always great exercises we can do. But to get really specific, one of the tools that I love to use is I use biofeedback. And this can be used internally, vaginally, or it can be used with these little electrodes that are placed on the outside of your body, right on the perineal body, which is between the vaginal opening and the anus. So they go right on the outside because that's where the pelvic floor muscles are most superficial, and you can pick up the best reading of what's going on with those muscles. And so I'll put this on and try to work on different positions possibly that you might use during birthing to see if you can relax your pelvic floor. It's really important when you're in the active phase of labor and pushing that you're not clenching and holding your pelvic floor muscles tight, because then you can just imagine it's like you're just pushing down on these tightened structures and there's no space for things to really come out, for the baby to be born and birthed. So it's really nice to practice and see what might be an optimal position for you. What might be some options to get into to see if you can release your pelvic floor. It also helps to use biofeedback in the opposite way, which is to strengthen your pelvic floor as well. You know, why not? Again, you have that snow cumulatively on your trampoline of your pelvic floor. And so that downward pressure can start to weaken things. It's great to keep your pelvic floor muscles strong and engaged. So biofeedback, it's really fun. It's really fun to use. Teaching you how to maximize the use of your diaphragm. So that is, you know, again, it's getting squished and lifted up, and you don't have always the space to breathe and access that normal breath, but you can still work your diaphragm. And what I mean is, like, if your abdomen is, you know, really large or toward the end, a lot of times we can develop a breathing pattern that's a little more shallow, and it's up here. And you'll see this breathing up here even at rest. And we want to work on calming this part down and working more on expanding your diaphragm. And the benefits are truly endless. It can help with stress reduction, calming your calming your nervous system and stimulating that parasympathetic nervous system to relax. Your whole body, it releases hormones, natural feel-good hormones that will help you to stay calm and relaxed. Believe it or not, breathing in that process, it's actually kind of rocking your baby too. Your baby feels those rhythms of you inhaling and exhaling. This also helps to aid in digestion. Your colon is squished many times, and this just helps to make changes and enhance those peristaltic waves, or the natural waves that we get in the intestines that help to move things along so you don't get stopped up. So, I mean, and we could go on and on about diaphragmatic breathing, but it has all of its benefits. This is not only during pregnancy, this is postpartum as well, and I'll hit on that in a little bit. Another thing that we can do is scar tissue of the perineum. This is especially important if someone has had a previous vaginal delivery that resulted in some tearing, because scar tissue is a natural thing to form. We need scar tissue to form. It, you know, closes things up. But in doing so, that tissue is not as extensible and stretchable as the normal, as the tissues were before the initial trauma. So it is fantastic to learn how to safely start to stretch the perineal body. Really, if I think of this in terms of, like, if you were looking at the opening, the vaginal opening, right? I look at it as a clock. And I like to tell my patients too, this is the clock. So 12 o'clock is all the way at the top. 6 o'clock is down at the bottom. And what often happens with tearing is we're looking more around 4 o'clock, 5 o'clock, 6, 7, 8. In that area is usually where the majority of any tearing or scarring can occur. And so that's where we would put our focus on that. Generally, we wait until about 34 plus weeks along in the pregnancy, unless we get clearance from your doctor first. But it is fantastic. And we teach people how to do it themselves as well, because it's really easy. It's not, it sounds scary and it can sound intimidating, especially because there's been trauma to that area before, but it really does help. There's also no reason why you can't start to work on those things for somebody who's never had a baby before either. It's nice to just be able to get a little bit of tissue extensibility to that area to prepare you. Okay, let's move on to the next one. So now here we are. You've talked about the things with during pregnancy. We'll just briefly kind of go over vaginal delivery versus C-section. And both methods definitely incur their own trauma. And this is physical trauma as well as emotional trauma. Emotional because, I mean, a lot of people come in and they share tears. It's very challenging, you know, to have not only all these changes postpartum and hormones are going crazy, this new baby that you have to take care of, and all on top of, you know, major sleep deprivation. But sometimes it's the event of giving birth can be traumatic as well. And a lot of times I'll have people that are very sad, or they feel that their body didn't do something right because the vaginal delivery didn't work out for them and they needed to have a C-section. Or maybe they really were intending on using no interventions, no epidural, no medications during it. And it just became too much and they needed that help. And so I promote and support any type of delivery that anybody chooses to have or even doesn't choose to have. It just happens. And the outcome we're looking for is a healthy mama and a healthy baby. But I do experience a lot. People have kind of emotional trauma. And so I try to be supportive on that emotional level as well as the physical level. So some of the challenges, though, specific to a vaginal delivery are tearing that can occur, or especially if there's an episiotomy. And sometimes we try to avoid, I think doctors and midwives try to avoid episiotomies, but sometimes it's what they need to do, But sometimes I think of an episiotomy as if you were to take a bed sheet, like the end of a bed sheet, and try to, or even my sweater. Let's look at that because it's right here. If I tugged and tugged and tugged on this sweater, it's not going to tear. But if I took a tiny, a nice pair of sharp surgical scissors and just put a little snip right there, you can believe that if I hold on this and I put enough force, it could rip down pretty far. And sometimes I do, episiotomies, although they are a medical thing that is up to the provider who's helping you deliver your baby. We trust they know what they're doing. And so sometimes it's necessary, but it can result in a greater tear, deeper and a little bit longer of a tear. Vaginal delivery also, I see more prolapse, and I'll go into greater depth of what that means, but it's basically when your pelvic organs are starting to descend or drop downward. Instrument assisted. So I'm talking like vacuum forceps. Those are pretty invasive devices. Again, I credit our doctors for doing what they, and our midwives for doing what they do to help us get our babies out healthy. But those instruments definitely can do damage to our pelvic floors. And then also the length of the pushing phase. I mean, your first baby, I hear all the time, people are 3-4 hours. It's like, whoo, that is a lot of pushing, a lot of downward force, you can create hemorrhoids in a matter of 2 hours of that type of straining. So vaginal deliveries have, a lot of those types of issues. C-section, obviously it is surgery. And so you have a deep incision, and you need to recover from that. So that's one of those traumas. You also have a lot of lifting restrictions, carrying, pain that, can come up there as well. And it can also change your breathing. Usually when we have a surgical incision, people will, without even realizing they're doing it, change breathing patterns or change positions to protect it. So with a C-section, a lot of times they're rounded or hunched, not feeling like they can stand all the way up straight, not wanting to breathe fully down into that area where it might just put a little stretch on the scar. And then I find that a lot of people who have a C-section also did go through a long pushing phase. So they've gone through that trauma and then also had surgery. So a lot of things can go on, but I do think overall it's really important to be able to embrace your own birth story. It is, it's your story. We all have these individual, ways of recovering, and just be real with yourself, talk to your, friends and get in to see a therapist if you're having problems with your full recovery. But they're all beautiful stories. I have heard hundreds and hundreds of birth stories. Not any two are the same. And I always feel like, why isn't this easier? Why is giving birth so hard? Shouldn't we just come with a zipper and just, let that baby come out? Anyway, no such luck. And, I'm skipping. Okay, I love this. It just makes me laugh. And I like to inject a lot of humor when I'm helping my patients out. So, the focus is all on taking care of the baby, but, what about taking care of ourselves? And I look at this and I think, why didn't I think of that? I should have trained, somebody needs to train our babies to take care of us, maybe. It just looks so soothing. maybe not in this world, but I do think, you know, getting a massage would be really nice. Everybody should treat themselves to a massage after giving birth, no matter what the exit route. Okay, let's talk about this. Everybody asks me, well, they'll say, I have no time, right? Like, where do you have time to take care of yourself in the early stages of after giving birth? The number one thing to do is breathe. And when I say breathe, I mean you have to do it properly. Remember that your diaphragm was shoved upwards, you know, way up high. Your lungs were squished. All of a sudden, they need to reclaim that space. They've dropped. In fact, some people, when they give birth, they'll make a sound like a sound, and it's like the lungs are they just all of a sudden released. And they're like, what? They don't even know what to do with this space. And we are creatures of habit. And some of us will naturally be able to start diaphragmatically breathing. Others, it just doesn't really come back. Especially with the more I see that with C-sections after that. So what I mean about diaphragmatic breathing is that as you inhale, your abdomen rises. And as you exhale, your abdomen falls. And basically there should be no movement of the chest. And I think I mentioned to Sarah ahead of time, I would love, once we get to the Q&A, like we should run through this together and try some of these exercises. But the first thing is truly just to breathe. And I think it's easiest if you start lying down or semi-reclined. I'll tell people, you know, put one hand here, probably can't see me, you know, but one hand here. And when you're in a calm breathing pattern, this hand should not move. And the hand down lower should just really slowly rise and fall. And I invite you all, like, we may as well just do it right now, right? Try this and try to just breathe through your belly. Once you have that down, and remember all the endless benefits, right? You're calming your nervous system, which helps manage stress and helps reduce worries. It releases those endorphins, those chemicals in your brain to be calmer. It aids in digestion. I think that one of the hardest things is like, when on earth is a new mom going to find the time to do this? And I think a great time to do it is when you're breastfeeding or bottle feeding your baby. You know, if you're holding your baby anyway, generally you're going to be sitting or semi-reclined. You could do it, you know, sideline too. You could really do it in any position, but you are kind of confined when you breastfeed in the beginning. You have to be somewhat still. So why not take advantage of that then? And your baby kind of being on your abdomen is a great, instead of your hand being here, it's kind of your baby. So you are, in a way, as you inhale and exhale, even rocking your baby as you breastfeed your baby. And it's a really nice, why not? You know, why not take advantage and do a little bit of something for you as you're taking care of this baby? So then once you get down that basic diaphragmatic breathing, then turn it into an exercise, right? So the exercise portion of this breathing is all as you exhale. Inhale is totally relax, let everything drop and fall. Let your abdomen will rise and your pelvic floor will drop a little bit. So from here to here, right, we have all our lungs here, but then all the way coming down to here, you inhale, abdomen rises, and it cues your pelvic floor down lower to relax and descend. Now the exercise portion comes on the exhale. So right as you go to exhale, you're going to lift your pelvic floor, wrap around your abdominal wall, right? Because these muscles, believe it or not, they start back here. And you're going to wrap those guys, pull them around to the front, like you're zippering from your pubic bone all the way up to the bottom of your ribs or the bottom of your breastbone there. This is a lot of instruction. We'll break it down because I think this is so vitally important. And at the same time, I like people to do what I call fogging the mirror. It's just a way of exhaling. So if you could imagine you're standing by your bathroom mirror, right? It's right here is my bathroom mirror. And you want to write your initials in it or scribble down a little heart. You're just going to go. right? You get that fog, you fogged your mirror. It's a really great way of kind of training yourself on this in more of an intentional exhale. So when you put it all together, it looks like this. You go inhale. Right as I start to fog the mirror, I'm going to lift my pelvic floor and squeeze it, wrap my abdominal wall together, all on this long, slow fogging the mirror. So this is tricky, I understand. If you feel a little overwhelmed, you should, because we get loads of people that come into the clinic that are just like, I don't get it. I tried, help me. And that's where it really does help to have some more one-on-one instruction. And we have lots of tools that we use in the clinic that can help with that. But to lift your pelvic floor, a great cue is pull your tailbone forward toward your pubic bone. You're kind of pulling those two spaces together. Sometimes that helps. Lifting it all helps for some. But what I don't want you to do is clench your face, squeeze your butt cheeks together, squeeze your inner thighs, curl your toes. It's gentler than that. And so a lot of people will struggle with that. And that pelvic floor contraction is also known as a Kegel exercise. Dr. Kegel, he was he's an OBGYN back in the 50s, nice guy. He knew that we needed to strengthen our pelvic floors. And we've just taken it further. So this is a combination exercise of lifting your pelvic floor, wrap those muscles together, and do it all on the exhale. It starts off extremely focused and intentional and challenging, but the key is that it will become and return to automaticity again, doing it naturally, doing it without having to think about it. And there is a whole progression that I do. It says fogging the mirror with a progression. I'm not going to get into that today, but there's a way that we work on that in the clinic that takes it from just this basic breathing thing all the way up to if you want to be doing kettlebell swings, if you want to be able to, jump rope again, jumping jacks, or simply just picking your baby up and going for a walk without having leaking or prolapse feelings. Okay. How am I doing on time, everybody? Good? Where's my clock? Okay, we're good. Okay, let's go talk about this now. This is such a hot topic. Diastasis rectus abdominis. You can just call it DRA. One thing, there have been so many myths about this. And 15 years ago, when I started working on this, I had a big diastasis. So that was one of the big things because I was one of those people, I felt so weak. I felt that I had no connection between my upper body and my lower body. And simply, I felt like I was bobbling with this squishy area that didn't know what it was doing. And, it was so hard, but I also didn't like the appearance. I did not like the way that looked. I noticed this big doming, tenting, like cone right here at my abdominal wall. I noticed that when I was pregnant, and I didn't know what to do postpartum to help myself feel stronger and pull that back together. And unfortunately, a lot of the information out there at the time was like, you cannot do a crunch. You cannot, lift weight. You cannot go on your hands and knees. You should not do a V-up or a leg lift. I mean, it was like, don't do this. But somehow, because I had this problem and I recognized being a physical therapist, like, I think I'm kind of doing it anyway. When I'm driving my car and I'm reaching into the back seat of the car to take what's going on with the baby and coming back, like, I just put so much torque on my abdominal wall. That was worth way more than doing a sit-up. And so I learned personally that women are going to be putting the demands on their core anyway. So it's really important that we teach them how to optimize the function of that abdominal wall with or without a diastasis, because that's how you're going to get it to heal and come back together. So that was 15 years ago. There wasn't great information. Now there's a lot of research that supports that you can do a lot of these things, but there's a right way to do them and a wrong way to do them. And that's what we'll work on. That's what I work on with a lot of people in the clinic, helping them with that. But some things to understand are, it is natural for this to happen. This is part of how our body makes space for this growing baby. It spreads and opens up. Now, if you're super long torsoed, maybe you have a lot of space for that baby, you don't present so big, maybe you won't even end up with a diastasis. But a lot of people do. It's not pathological. This is not something that is, like horrible or will require surgery. In most cases, I'll talk about that in a second, but for the most part, our bodies want to come back together and they want to heal. And this, it's not pathological because we look at it more now too. But we are, as women, right? We are usually very concerned about that split. How far apart is our abdominal wall? But we as abdominal physical therapists are now focusing a lot more on the depth of how far that goes, and if the fascia underneath is still intact, and if we can teach you certain exercises and breathing patterns, you can start to pull those walls back together. And by the way, that breathing as an exercise that we just did, that whole wrapping of the abdominal wall, that is your first step to reducing your diastasis. So another thing that I think is very important, I wrote that it will not get worse. The reason why it happened in the first place is because you had this growing baby in your abdomen. The baby is now out. So those pressures, you're not going to have anywhere near that type of pressure. So it's not going to get worse, but these weaknesses can lead to other issues like back pain and your belly pooch that we don't like to see, the distended abdomen. You could be at risk for hurting yourself because if you don't learn how to minimize that gap, then you're probably not activating those muscles right before you pick up your baby or before you pick up a kettlebell or try to jump rope and all these different things. And so you are at risk for injuring yourself. So as a physical therapist specializing in this, we really work on how to properly bring this abdominal wall back together, how to coordinate it with your pelvic floor, and then how to turn that into functional things so that you can do the simple acts of taking care of your baby and not have pain. So diastasis is huge, but we can get through this. You can definitely heal from it. Now, I did mention surgery because some people will say, I've seen this all over the internet, they're lying to you. If somebody tells you that you can fix this, it's a lie. The only way to fix it is through surgery. And that's actually not true, but there are some instances, and I would say over 15 years, I can think of less than 5 people who actually needed to have surgery to repair it, meaning it was so widely spread, and even with trying to train them to bring it back together, they still really couldn't come back together. It's really rare. I just haven't seen a whole lot of it. More often than not, the reason why people will choose to have surgery is, yes, maybe the wall is a little bit separated, but it's more cosmetic. A lot of it could be cosmetic. They don't like the extra skin maybe that they have, or stretch marks that are left on your belly, those like battle wounds from having a baby and being pregnant. And that is a total personal choice, and if that really bothers you and you're done having babies, go for it. Do what you want to do to feel good about yourself. And PT can't help with the skin per se. We can't get rid of those stretch marks for you, but we can teach you how to use your muscles so that you're strong again. So there are times where surgery is either a personal preference or in that rare instance where that abdominal wall is not coming back. And then you'll want to go see a surgeon for it. Okay, prolapse and incontinence. I just put both of these together on one screen. They both deserve their own. They're such big issues, but I'm just kind of going to lump them together for the sake of time. But you can see in that upper left corner, right, the no prolapse picture. So the little sling there that you see, that's the pelvic floor. And the one to the left, the far left where it's tied up, that's where your pubic bone is. And then towards the back is where your coccyx and sacrum would be. And then you can see these three little blobs, which represent different parts of your anatomy, your bladder and your uterus and your bowel or your rectum sitting there on this sling. And so with a cystocele, this is where part of the bladder is starting to push downward into the vaginal wall. With a rectocele, you can see part of the rectum is starting to come down through that little sling there, the little vaginal wall. And then the same thing with the uterus in the middle. And so more common, I see this after a vaginal delivery, but certainly, again, going back to that whole analogy of that snow, the accumulation of the snow on the trampoline, right? Even if you had a C-section and the baby didn't pass through your birth canal, you still had a lot of weight from your baby and your uterus and your placenta, everything pushing downward on your sling over time. So these things are possible for anybody to have. Usually it feels like this heaviness or an ache, pressure. Sometimes people will even come in and say, Kathy, I feel like there's something in my vagina, almost like there's a tampon that's in there, but there's nothing in, what's going on. It's a very uncomfortable feeling. There are grades to it. So a lot of women will have a grade 1 and not even really know it. And I find that in my initial exam. Maybe their complaint is they leak when they sneeze, and I see, oh, you got a grade 1 or a grade 2, let's make sure we figure out how to teach you to get those organs back up there and tighten up that hammock or sling and make sure that you're doing things properly. So, but it's not a good feeling, especially when it gets to that, more advanced stages, and it can actually prolapse outside of your body. And that's a really scary feeling for a lot of people. But that said, I have helped so many people who were that bad learn to reduce or, raise back up those tissues, and with some modifications to their lifestyle, not have surgery. So there's a lot that can be done. Incontinence, this is leaking, and it can be urine or feces. It's no fun. A lot of us will make little jokes or, oh yeah, I don't jump on the trampoline anymore, I'll leak. Or with that exercise class, everybody's doing jumping jacks. I just, I stand and I kind of do my little one leg things, sneezing, coughing, laughing out loud, picking something heavy up. All of these things, they are common, but they are not normal. And if there's anything we can, if you experience this, please don't feel alone. Please don't be embarrassed. Tell your doctor and get the help that you need, because these are all very correctable things. And the earlier you correct them, the better off you are for the whole lifespan. I know we're kind of talking just about pregnancy and postpartum, but this is for the span of our life. We still have all these organs, and I do see a lot of people that will come in around age 50, let's say. Now they're perimenopausal, hormone levels have dropped, tissues are, thinning and maybe not as used as much, they're weakening. And this little dribble, this little, thing that they used to laugh about when they would cough or sneeze is now really a nuisance. And they're leaking all the time, and they're not having that control. Or sometimes it's even, they get sudden urges. We sometimes call that the key in the door, or the running water syndrome, where all of a sudden, out of nowhere, your bladder screams at you like, I gotta go. And people do the little potty dance and race to the bathroom, usually don't make it quite in time before they start leaking. And it's horribly embarrassing. It gets in the way of our lives, and it's completely unnecessary. There's a lot of help that can be done so that we can live fully and freely and have control over our own bladders instead of our bladders controlling us. On this slide too, at the very bottom, I wrote about the weaknesses of the muscle, fascia, ligaments. That's that whole support system, that white mesh sling that you see in these images. But when you combine weaknesses of those tissues with in coordination of the pelvic floor, this is just bad recipe. You're going to have problems. And so what I mean by this in coordination is when we cough, let's say, you should automatically tighten your pelvic floor just before you cough to tighten up that hammock or sling and provide that support so that as you cough and your diaphragm up here is going to contract, the forces, we don't want them to go down. If those forces go down, your pelvic floor just drops. You're going to experience leaking and or prolapse. And you can actually create prolapse over time with heavy lifting. This is Park City, right? I mean, we're a very fit community, and I get people who are doing lots of heavy lifting, and they should be able to do it. But if they haven't learned that mechanism of bracing those pelvic floor muscles first, every single time they're pushing downward, that force is going down, weakening that support system. And especially postpartum, it's already especially weak. So you have to learn how to coordinate those muscles. That contraction should happen first. That brace should be in place first to absorb that downward shock that's coming down, because it's a big force. And that's why it's so common when people cough, sneeze, lift, they just have a little drop, or more than just a little drop, oftentimes too. And so coordinating those muscles is absolutely important. Even more important, I think, than having, a 5 out of 5 pelvic floor strength. You could get by with a 3 out of 5 strength, but if you have the proper mechanisms and coordination in place, so much better. It's going to be so much better for you. We do a ton of this in the clinic. I use, again, biofeedback. If someone's really weak, we could use electrical stimulation. That helps to wake up and it helps your brain and body reconnect these muscles. We will take these exercises not just to lying on a table in an exam room, but also let's start transitioning to the things that people want to do. Bring your baby in, let's practice repeated squats with holding your baby, because that's life and what you do. Let's practice bending over like you're going to be diapering the baby and coming back up, rocking the baby or sitting on an exercise ball, bouncing the baby, all these things we do. And then we get it also to function. Oh, okay. You want to be able to do jumping jacks. Well, let's build up to that. Let's get you, you want to run a 5K. Let's get you up to doing that too. So we put in these foundational blocks, and then the sky's the limit. We work on whatever your goals are, but it does take time. There's no quick fix. Sometimes I'll compare it to like if you had your ACL reconstructed, right? Everybody know what your ACL is. It's a ligament in your knee, really common ski injury we see here. If that was torn and you had surgery for it, everybody in your world would understand that you need help. You need physical therapy. This is going to take time to recover from. And so much like that, that's how, and every surgeon, any surgeon who fixes your ACL is referring you to an orthopedic physical therapist. It's just how it goes. They are innately related. There's no way of getting your ACL done and not getting a referral to PT. So why are we having babies and not being automatically given a referral to see a pelvic and abdominal health physical therapist? This is the main message. So we have to advocate for ourselves, ask for that. All these benefits that we have, they're right here. There's many of us here in all around the United States, and we want to help you, and we want to help the doctors understand too how much we can help you guys improve. So it should be automatic, in my opinion. Everybody should get a referral to physical therapy. And let's just talk about some indicators that you should see. Go, Sarah. Sorry.
I was just we had one question that referred back to the last slide. So I just wanted to ask about we had a question. Will Kegels help with a urethra that appears to enlarge, like prolapsed? This is paired with, how do you say, systosely prolapse?
Yes.
Mm-hmm.
Absolutely.
So the question being, will Kegels help with a urethra that appears to be enlarged?
Yes. So sometimes, like if you were visualizing the urethra itself, there's some tissues around it and they can look a little enlarged, and your urethra could also prolapse too or descend as well. And absolutely. So a Kegel exercise is all of these things that I'm talking about with bracing of the pelvic floor muscles. That's what a Kegel is. We've just kind of, as pelvic floor therapists, we've taken that term to mean a lot more, just of the lifting of all of those muscles, the squeezing of those openings at the same time, and then incorporating working the abdominal wall all together. And absolutely a Kegel or a pelvic floor contraction is going to help if you're doing it properly. And that's where I go back to that in coordination. So often people think they're doing it right. And I'm looking at them though. I can see their pelvic floor. I'm looking at it and it's bulging down right at me. So I say, okay, you know, go ahead, contract your pelvic floor. And I look and it drops. That's the incoordination that I'm speaking to. When I look at somebody's perennial body, as you know, when I'm looking at their outside of their pelvic floor, when they do a proper Kegel exercise, it should draw up. And the incoordination, I'm so glad that thank you, whoever asked that question. It's fantastic because I need to explain that better. That's that I see it. Most people can't see it themselves, but they're actually pushing their things, they're pushing their organs downward. That's the incoordination. So the beauty of that is, yes, we usually get coached by our physicians and midwives, do your Kegel exercises, but so many people aren't doing them properly. They're doing them completely the opposite of what we want to see. In fact, they're pushing their organs downward instead of lifting them upward. And so I'll get people in all the time and I tell them, visit one, I want you to know how to do this muscle contraction, and I want you to have the confidence that you're doing it properly. And I start with simple breathing, and then with each visit, we build upon it. So yeah, that's a great question.
Thank
Yes.
you.
Do those Kegels. Just make sure you're doing them right. And if you're not sure you're doing them right, seek me out or seek out, you know, another pelvic floor physical therapist, and because it doesn't take, it's not hard for us to tell you.
It's a good segue to your next slide.
Right, there we go. Okay. Yeah, right. Look at that. The number one, you've been told to Kegel, but you're not sure you're doing it right. That is big time. Because if you're doing it wrong, you could potentially be damaging and weakening yourself. If you leak urine when you sneeze, exercise, laugh, cough, whatever, you can fill in whatever there. If you leak urine when you don't want to, or feces when you don't want to, please talk to your doctor or come see me. If you need to get to the toilet in a hurry and you often don't make it there in time, if you find it difficult to fully empty your bladder or bowels, constipation is, you know, the bowel portion of that. If you're struggling with constipation, every time you strain, you are weakening your pelvic floor muscles, you know, leading to weakness of the muscles, potentially straining or damaging the supportive structures like the ligaments and the fascia. And so it's really important. I teach a lot about constipation. I actually have created a fun little handout called How to Poop Properly so that people learn the right ways of opening up your bowel so that things can slide more this way versus hit a kink and not be able to get out. I give basic dietary and nutritional information on fiber. There's recipes that can help improve bowel regularity. Tons of stuff on bowel. We didn't even really talk about that. Tons of that. You know, an indicator is if you have hemorrhoids and they're really bothersome to you, there's a problem, and you shouldn't have to live with that. Hemorrhoids are like these, well, they're varicose veins, basically, of the anus, but they can be like volcanoes, and they can be super active and exploding, or they can be dormant. And the goal is to get them to the dormant phase. Because once you've had a hemorrhoid, it's usually going to kind of be lingering around, but we can get those under control so they are not problematic and you're not having issues with it. Okay, if you're urinating more than once at night, that's a problem. We call that nocturia. If you are breastfeeding a baby or you're pregnant, you know, later stages especially, and you're getting up for that, that's fine. But once the baby's sleeping through the night, you should be too, and you shouldn't be waking up to urinate. Interestingly, we had, the Hive Family Collective hosted Dr. Wendy Troxel. She talked about sleep last month, how important that is. And if you're waking up to urinate a lot, then that's interrupting your REM sleep. And that's really important to make sure we fix that. If you constantly need to go to the toilet, or you feel like you have a small bladder, I get people who tell me all the time, oh, it's just this tiny bladder. It's the way I am. No, really, probably not. There are some very rare things that could be there, but in most cases, you've just trained your bladder not to fully expand. And so that's a problem as well. If you're losing control of your bowels or accidentally passing gas, if you're not wanting to let it out, then you should learn how to strengthen those muscles. Prolapse, we already talked about that. And you might not know you have a prolapse, but you might feel those things, that bulge, heaviness, discomfort, pulling, dropping down, all those different things. Any type of pelvic pain or abdominal pain, back pain, all the pain things we can help with, but specific to pelvic health is, and especially to being postpartum, I don't know, there's just this magical 6 weeks, go for it, and with exercise, go for it with your intimacy. And a lot of us just can't quite do that comfortably. You can try. I highly recommend a good amount of lubrication and taking it easy the first few times back to intercourse after giving birth, but that should resolve pretty quickly. And if it's not, talk to your doctor or come see a pelvic health therapist, because we are trained to help with that. You should not have to suffer with pelvic pain.
And actually, there was a question specific to that, more about exercise than intimacy, but what does it mean to be cleared by a doctor? Are all exercises okay? Can you go to 100% where you were before?
I don't really understand. Again, my background is in orthopedics, and I'm just going to keep using the ACL because a lot of us know. The ACL is not okay, you're 6 weeks, post-surgery, go for it. We look at the ACL reconstruction in phases of rehab. We first focus on control of pain and swelling, and then we get your motion going, quad activation. Now we start doing some more athletic type exercises, squats, lunges, and eventually we get you back to your sport at 9 months post-op. You're skiing and doing moguls again. I don't quite understand this magical 6 week. And I think it sets these expectations up for people that really can make us feel defeated at a time where we already feel pretty vulnerable after giving birth. It's so normal to not feel good at 6 weeks and ready to go back to exercise. A lot of women are so focused on, I want to lose weight. So the first exercise they think that they should do is run. Some cases, yes. And maybe if you kept running through your pregnancy, okay. But in a lot of our cases here, your pelvic floor is so weak. It's not ready to support the repetitive boom, boom. Your abs aren't quite back yet. Your pubic bones themselves are still not closed, and come back together. So exercise, just like with an ACL, should be in phases. And that's why I have protocols that I've developed. And in order for you to be able to do running, you have to pass off all these, you have to prove to me that you can do all these other things first before you can get to that. And that's how I know you're going to do it safely. And you're going to get a lot more enjoyment out of that run or out of that workout if you feel whole, if you feel like you're not going to leak, or your abs are going to split. So exercise is really challenging to get back to. But it's, again, our bodies are made to do it. And I love coaching people through those things, making sure that they feel good while they're doing it and that they're not going to do any damage. But yeah, the whole thing, I don't know.
I know it's so tricky, but I had another question that what is one of the most common like return to exercise mistakes that you see that you wish you're like, I mean, you mentioned running. So
Yes.
is there anything else that, you know, the mamas need to be cautious of in returning back to
Yeah.
exercise?
Well, I mean, a great thing to look at is, first of all, make sure that you can, if you can feel like you could tighten your pelvic floor and hold those muscles tight, if you can at least slow down the stream of urine if you're urinating, and if you can at least slow it down a little bit, not as an exercise, but just as a test you might do, you know, once a week. Can I slow that down? Do I have any control over my pelvic floor? Does my abdominal wall, like when you want to, whatever the exercise is, can you do that without getting that bulge that, you know, in your abdominal wall? If you can hold yourself together from the bottom up and from the sides in, and you're not having pain, you're probably good to go with that exercise. But what I see as a big mistake is just this unknown, like, what do I do? And so we go back to what we know, which sometimes is HIIT classes, for instance, right? They're very popular, high intensity interval training. Maybe you're doing burpees and mountain climbers, jumping jacks, you know, step ups, all these different things. And your body's just not quite ready for that yet. So I think in terms of like, what's the biggest mistake? The biggest mistake is trying to start from here, just giving birth, and then all of a sudden jumping to right back where you were. You have to start with simpler things. And the breathing is the most important thing. I mean, it's hard to say because I have all these different protocols of stages we go through with exercises. But bridging, does anybody know what a bridge is? You know, where you lie flat on your back but then your knees are bent and you simply just lift your hips up, lift your buttocks up off the ground. That's a great exercise to do too, provided that you're able to contract your pelvic floor and pull those abs back together. So I think the biggest mistake that we make is putting this expectation on ourselves that, okay, I'm 6 weeks, the doctor said I should be good to go. And most women, the women that I'm encountering at least, they don't feel right doing it, and then they kind of beat themselves up over it because they're like, well, my friend's doing it and she feels fine, and why can't I? And I don't think that 6 weeks is a realistic expectation. I just don't. I think a more realistic expectation to be getting back to all those things you want to do is for like 9 months, just like an ACL, you know. And some people it's going to come sooner, and others it might come even a little bit later. But to kind of cut ourselves some slack and reset these expectations that we hear about, you know, we're kind of resetting them so that we don't feel defeated is very important. And just start slow and then build your exercise, you know, up. And if you're not sure, go, you know, come see a therapist. We'll help you.
Mm-hmm.
Yeah. Did I give that a good answer?
Yes, it was excellent. And I think that it's, you know, it's a common one that we come up with after having a baby, because you're right that you miss having that endorphin rush of going to, you know, Boco or, you know, whatever you left, your Orange Theory or running your 6 miles so I think that was very thorough. Thank you so much, Kathy.
Yeah, you're welcome. Okay. Where was I at? Okay, so yeah, so see, second line to the bottom. If you notice that coning or dome in your abdomen with certain movements, relearn how to brace those muscles. It's like magic. I'll have somebody on the table working with them, and I don't let them know necessarily I'm observing everything that's going on, but they go to get up off the table, or let's say I have them laying down and I teach them how to properly, you know, coordinate those muscles. They do it so great. And then they get up off the table, and the act of going from lying down to sitting up, they didn't connect the dots, and boom, their abdomen cones or, you know, bulges outward. And it's like, okay, this person has the ability to do it, but they haven't yet connected that ability to functional movements. And so then I'll go back and teach them those things. So a lot of these exercises that maybe you want to get back to doing and they don't feel good, it's simply a matter of learning how to brace your abdominal wall. And you can try it on your own, you know, and if it works for you on your own, that's great. But if it doesn't, learn how. Let's lay down these neural pathways very early postpartum, so that you can begin that healing process. And, you know, also to speak to that 6-week mark, I would love for everybody to come in at 1 week postpartum. I feel like there's so much that we can start doing right away in terms of education and just starting to, again, bring up those neural pathways. We understand that when you have a C-section, for instance, you're not supposed to be lifting or doing certain things. But I've never met a woman who had a C-section who isn't picking up her baby and who isn't carrying that car seat around. You know, we all are doing those things. And so since you're going to do them anyway, you may as well get the foundations of how to do it properly so that you don't hurt yourself, or you know, minimize the risk to hurting yourself. So I am all for getting people in sooner, but I think it's challenging because you just had a baby, half of the months of Park City, it's blizzarding outside, you know, or it's flu season, you're worried about getting out. Now we're dealing with this pandemic. Nobody wants to leave the house with a new baby. And so it's even extra challenging. And so that's why I think things like this are fantastic. And I've expanded my ability to reach out, you know, do outreach with people kind of on private consultation routes now, of whether I come to your home or whether you feel more comfortable just doing Zoom, so that I can try to get to people at earlier phases postpartum, but still making them feel safe, you know.
And Kathy, is insurance paying for your visits typically, or are we working on that as a culture as well?
No, yes, it is completely accepted now as standard physical therapy. In fact, the billing codes I use are the same ones I would use if you did come in for your ACL or something else. Same codes, just a highly specialized treatment. But so your insurance plan, if it covers physical therapy, as they all do, this is definitely covered by your insurance plan. And MountainTop, where I work at, covers, I don't even know of an insurance plan that we don't take. I think we take all of them. So yeah, that's a really good perk. And usually when you've had a baby, you've met your deductible. So you may as well take advantage of that and come on in. I also do welcome people. I always have. I think it's such a weird time right now with the COVID-19 thing going on, but I've always welcomed my new mamas to bring the baby in with them too. It can be challenging at times if the baby's not sleeping or whatever, but it's always great for me to see how somebody moves. How do they functionally pick up that baby, or the position they hold the baby in when they nurse? And I can give, you know, right there, real-time feedback on posture and corrective movements and such to help out. So I think it's challenging now because of, you know, because of coronavirus and people maybe not wanting to get out so much, but yeah.
Yeah, there was one more question, and then I think our time maybe will wrap up. If anyone else has a question, please do send it my way. But and this was a question I had too, actually, and it came from one of our mamas. But you spoke about pelvic floor structures being too weak and uncoordinated. But do you want to touch on how pelvic floor muscles might be too tight, and what would the symptoms might be, and what are those implications for birth?
Definitely. Okay, so muscles that are those, when the pelvic floor muscles are tight, it usually will present as discomfort in some form or fashion. It's often the ability to fully relax those muscles and let them go. Sometimes it's been in response to pain. So a term that we use, dyspareunia, is just basically pain with intercourse. And once somebody has experienced pain with that, it is our bodies are wired to be like, oh gosh, it's going to happen again. I'm going to feel that pain. And then those muscles tighten. It makes it even more difficult to have, intimacy. Sometimes you can't even, you can't do anything because it just hurts so bad. And that could be in a response to previous pain that you've experienced. Now you've got this tightening mechanism in place. Pain can run the gamut. It could be a pudendal nerve issue. It could be, there are dysfunctions even called like vestibulodynia, where we have our nervous system and there's too many nerves, highly sensitive, and that can result in tightening of those muscles. And so as in physical therapy, we work on trying to relax those muscles, right? The pelvic floor is dynamic. It's meant to pass things through it, right? Liquid, solid, babies, etc. And it is also meant to close all of those openings and hold things in place. And so the pelvic floor isn't supposed to be tight and shrugged up here. It's supposed to be fluid and able to sit. I use my shoulders a lot as an example for my patients. And I say, well, this is a tight pelvic floor. This is kind of like, you're just sort of in your relaxed and resting state. And then this is when you bear down. They should drop and descend. So that pelvic floor, that sling hammock that I was showing in some of those images, should be able to lift, kind of rest, and bulge. And it's a beautiful art of teaching people how to find that balance. Somebody who also has a tight pelvic floor, remember I mentioned that one of the previous slides about using biofeedback to train people how to relax their pelvic floor, which can help during the delivery process, but that can also help to have a bowel movement. If you struggle with constipation and your pelvic floor is always tight, right? We have terms we use all the time. Oh, she's anal retentive, or we say things like that because those muscles are kind of bound and wired. And just like some people tend to hold stress here, these people come in to see us because they have neck pain. Some people do that same mechanism in their pelvic floors for so many different reasons, but we work on helping them find that balance, find that dynamic component to their pelvic floor so they're not stuck in any one position.
That's good. And then what is an initial appointment and exam with you? Like, what does that entail? What does that look like?
So I have worked it out so that I get an hour with the patient. I want to get a very thorough history at first. I want to sit down and I want to talk to you. And I want to hear all the concerns that you have. And then I'm going to ask a whole laundry list of questions, because the person who might come in because they have pain, I'm going to find out that they actually have 5 other things going on. It's just that pain was their priority. Once I feel like I have a really thorough grasp of their history, including like any surgeries, any abdominal procedures you've had done, birthing stories, trauma, even, abuse potentially. I want to know everything and really build up a nice rapport and get to know one another. And then I want to do a very thorough physical examination. And this is similar to a pelvic exam that you might get from your, if you're going to get a pap smear, except I don't use a speculum and I don't use stirrups. You would be on a table and I coach you along through it all. I want to really visually look at your external body. And then with your permission, I would do an internal examination vaginally. And if also a concern, we would do a rectal exam just to address all of the issues, see what any limitations are. And the whole time I'm going through it, I'm explaining what I'm doing, what I'm finding. And then once that's done, just depending on time, sometimes the history that I gather will take 40 minutes of talking. People have a lot to get off their chest. It can be very emotionally connected too. And so I need to give people their space and time so that they feel fully heard and supported, so they trust me. you know, because these are pretty intimate things we're dealing with. So if time permits after that, you know, pelvic examination, then I'm gonna, no matter what, you're gonna leave with some bit of homework, some bit of written information that I want you to take and just start working on. I also like to let people know, hey, these are my findings and this is the path. And I like to very first visit, set those expectations, because if somebody leaves and thinks that they're going to be better in 1 month, but in my mind, I'm thinking 4 months, they're going to feel really disappointed. I need to make sure they understand, hey, this is going to be a road to recovery. I've got your back. We're going to take this journey together and you're going to achieve all these goals. So, yeah.
That's great.
Yeah, I mean, and subsequent visits go every which direction. It just,
I know. No, it's nice you have that much time, you know. And I have to say, my experience, you know, I had my last baby 11 years ago, and I was in a prenatal yoga training class last year. I had a workshop with a pelvic floor physical therapist, and I just was so surprised with even how engaged I am with birth, how little I knew about the pelvic floor, and how I was hypertonic instead of loose. I mean, there's so much. So I have been working with a PT, and I just think our country, it's a disservice that we don't have this included in our package of maternal, you know, wellness. So I think as part of, you know, Hive's initiative is to share this information just as education, so we know where, you know, what's going on in our own bodies.
I mean, even as you're a doula, you're a healthcare practitioner involved specifically in babies being birthed, and it's still like revelation, like
I know.
whatever.
I know.
I'm gonna make up a word right now.
And you think it's 2020, you know, we could be a little bit more progressive. But if anyone has any other questions, I have asked them all, so we can either wrap up and thank you, Kathy, for sharing your contact information. So again, you know, Kathy works at MountainTop Physical Therapy, which is next to Hugo's Coffee in the Olympic Parkway, right in that visitor center. So, well, I think it's a wrap. I just, on behalf of Hive and our mamas that are here with us live and those that will watch us, we really thank you so much for donating your time, donating your expertise, and just helping us all grow in feeling better inside and out, so we can spread the word. And we'll link this to our website, and I'll send an email out. But Kathy, thank you so much. It's such a pleasure to work with you.
Thank you. I feel so honored to have had this opportunity. I think what the Hive Family Collective is doing is so long overdue, and I'm so grateful. You guys are the women making it happen. And everybody who's tuning into this, whether it's live or later on, you know, take care of yourself and tap into all of us. Let us help you. We want to help.
Thank you so much. Have a great afternoon, everyone.
Thank you. Bye.
Bye-bye.